TV bora ya maadili inayotupa tupa ya kheri, hivyo nyote mujue hili. TV Al-Haajar TV bora ya maadili inayotupa tupa ya kheri, hivyo nyote mujue hili. TV Al-Haajar twatangazia dunia, leo twawapa habari, twamshukuru jalia kutuletea ya kheri. TV imetujia hili yetu Al-Haajar, TV imetujia hili yetu Al-Haajar. TV bora ya maadili inayotupa tupa ya kheri, hivyo nyote
Yes, wa alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Yes, good. How are you, Atim?
Alhamdulillah, I'm fine.
Yes, karibu.
So, watazamaji wa Al-Haajar TV, karibuni katika kipindi cha afya na jamii. Leo ni kipindi cha tofauti zaidi. Leo tumekuja katika kituo cha Mombasa Cancer Center. So, I hope sijapotea daktari.
Uko pahali the right place. Yes, Mombasa Cancer Center. Karibu sana.
Asante sana. Iko wapi located? Because I remember the last episode we talk with you, tulipokuwa tuko Aga Khan, kama kama sijakosea.
Ilikuwa ni ofisi yangu kwa Mombasa Hospital.
Mombasa Hospital.
Ile ilikuwa ni outpatient clinic, lakini hapo ni the center penyewe ambapo tunafanya matibabu ya cancer. Na ni day care center ambapo tunapeana chemotherapy na matibabu mengine za cancer pia. Karibuni sana.
Asante sana.
Hapo ni kwa reception. Na huyo ni Benta, our receptionist.
So,
yes. Now, this is the lab. This is the main place where all the tests are done. We meet with Laura, our lab technologist, and we have put kind of better machines which can give us results fast enough. Kwa sababu watu wetu wana wagonjwa wetu, lazima kila mgonjwa ambaye anakuja anahitaji kufanyiwa aina ya tests na investigations, alafu wanasubiri hapo. Kwa hivyo tunataka wapate majibu haraka haraka. Kwa hivyo hizo mashini makubwa zinaweza kutoa majibu kwa haraka zaidi, wasihitaji kuketi kwa muda mrefu sana.
So doctor, unamaanisha kuwa there's no need. Zamani nilikuwa tunaambiwa mtu mgonjwa wa cancer na vipimo vyake ni lazima ziende Nairobi, vitu kama hivyo. No need of that again now?
Kuna baadhi za vipimo which still need to go to Nairobi, but most of them can these days be done in-house. But then there are those specialized, very specialized tests which we still need to take them either to Nairobi or sometimes even fly overseas for those very specialized tests. But by and by we are getting more and more technology within the country, hata within Mombasa tunaweza kufanya.
Congratulations. It's a big step for having a cancer center.
Thank you.
Here in Mombasa.
This is the office of the manager. This is Irene. She's the facility manager, and she's the one who coordinates the whole facility.
Thank you so much.
This is the pharmacy. This is where they store the drugs. Our pharmacists are here, Patrick and Stella. And we stock all kinds of medicines ambazo zinahusiana na matibabu ya cancer. Kutoka chemotherapy na kutoka madawa zile ambazo watu wa cancer wanahitaji, as we will discuss later on about the side effects of chemotherapy na madawa mengine ambazo watu wa saratani wagonjwa wa saratani wanahitaji.
Thank you so much, Doctor. Asante sana kwa kunile. I see, Doctor, here in your center, the different posters, something like this. When I saw a ribbon, a purple ribbon, because we see different ribbons. We see a pink ribbon, the purple ribbon. What does the purple and the pink ribbon means to the cancer?
So each One is that each month we celebrate or we give information about a certain cancer. The commonest one is breast cancer, which is in October. And each cancer is represented by a certain color of the ribbon. For example, breast cancer is represented by pink ribbon.
Breast cancer.
Yes.
That's pink.
That's
so
pink.
When we say someone wearing a pink ribbon, it means he's aware of the breast cancer.
Yes, or is an advocate of the breast cancer. Ama anashughulika mambo ya cancer ya titi. Yes. Kwa hivyo kila ribbon na rangi yake is it has its own.
I want to know more about the purple one. The purple ribbon.
The purple one is was designated for the Cancer Day, which is on 4th February.
That's the general one.
Yes, the general one. And we usually also hold cancer screening camp in this facility on that day, free of charge for anybody who wants to come and be screened for cancer.
Thank you so much.
Now we are coming to the main place whereby chemotherapy is given, and right now most of our patients have already finished doing the treatment, but we have beds and we also have chairs. And that is why we have chairs, because chemotherapy is not supposed to be such a big thing as people feel about it. We want people not to feel that they are sick and that they need a bed. We want them to sit on these chairs to relax. It's a short chemo. They can sit, they can do their work as well, and they can sit and interact with other people as well. And these are recliners, so they can sit and relax if they want to recline. So you see, now I can recline and I can see my normal work, and I am in a relaxed position. These are our nurses who take care of the chemotherapy patients, and they administer the chemotherapy. And this is the place whereby all the mixing is done for the chemotherapy, and we have the machines whereby we can safely mix the chemotherapy drugs.
Naam, asante sana mtazamaji wa Al-Haajar TV Afya na Jamii. Kipindi hiki chini ya ushirikiano na taasisi taasisi ama muungano wa madaktari na wauguzi wa Kiislamu katika taifa hili la Kenya Kampa. Tuko katika, bado tunaendelea kuwa katika eneo hili la Mombasa Cancer Center baada ya kupata matembezi katika kituo hiki ambacho kinasimamiwa na Dr. RIYAZ KASMANI. Hapa tumekuja katika kufanya mahojiano tupate kujua, na leo tutazungumza. Wiki kadhaa nyuma katika kipindi cha Afya na Jamii tulipata fursa kuzungumza na daktari kuhusiana na gonjwa la saratani kwa ujumla, lakini kwa sasa leo katika kipindi hiki tutapata fursa kuelewa mengi zaidi kuhusiana na masuala mazima ya chemotherapy. Unataka kujua chemotherapy ni nini na utofauti wake uko wapi? Wenyewe wanasema kuna types of chemotherapy. Sisi wengine tulikuwa tunajua chemotherapy ni moja, lakini leo daktari hapa ameninongoneza kuwa tutakuja kujua mengi zaidi. Lakini umepata kufahamu kuona chemotherapy dawa zake zinavyochanganywa. Daktari, asante sana kwa fursa yako kututembeza katika facility hii ya Mombasa Cancer Center. Na moja kwa moja doctor, on today's topic, what is chemotherapy?
So chemotherapy, it's just a name of drugs. The way these are drugs which help to melt cancer and to deal with cancer. Just the way we have antibiotics, these are the drugs which deal with infection and help to kill infection. So chemotherapy are drugs that help to kill cancer. It's just the word that is too big that scares people, but otherwise it's just a name of all the medicines. So there are different types of medicines that can kill cancer. We have medicines which go through an infusion. Infusion means that they are going like a drip. There are drugs which are taken like a tablet and they are chemotherapy. There are also hormonal treatments. These are also part of chemotherapy. They are part of, some of the drugs are given as an injection in the muscles. There are some of the injections which are given in the fat, maybe like in the stomach, the way you give insulin treatment for diabetics or so. And there are so many different types of these medicines, which are all under the umbrella of chemotherapy.
So doctor, tulikuwa tunajua chemotherapy at the rays. Is it true? Those rays, it's like people talking, said chemotherapy ni kama kupigwa pasi, sijui kuna some rays.
Mambo ya rays ni radiotherapy. Hizo ndizo radiotherapy rays. Ni aina ya mashini ambayo unaingia ndani, alafu kwa Kiswahili watu wengi wanasema tunachomwa. Hiyo ni radiotherapy. Kwa hivyo there are radiotherapy rays which penetrate your body and kill the cancer inside. But it's not like kuchomwa, it's not like anything burning, where hata utasikia kitu chochote wakati unaingia ndani ya mashini. Ni kama vile unaenda kupigwa picha ya CT scan ama hivyo, mgonjwa hasikii kitu chochote. Anaingia ndani, ni hizo radiotherapy rays anapata, inapiga picha, anatoka, hajasikia kitu chochote. Hakuna maumivu, hakuna dalili yoyote anasikia. Lakini sasa hizo radiotherapy rays ni more intense, kwa hivyo zinaingia pale ndani mpaka zinachoma hiyo cancer, but mgonjwa hatasikia kitu chochote. Pengine baadaye inaweza kufanya mabadiliko kwa ngozi around there, they can get some skin rash or discoloration. Kwa mfano kama ni titi, wanaweza kupata discoloration pale, getting the place becoming dark or a bit of skin peeling off, but otherwise they will not feel anything while the treatment is ongoing.
So there is a radiotherapy and chemotherapy.
Yes.
So also for cancer patients, they do radiotherapy?
Yes, they do radiotherapy as well. So radiotherapy is the treatment which uses the radio waves to kill cancer. These are done by a big machine, and those waves pass into the body and kill the cancer inside there. Chemotherapy is use of medicines to kill cancer. And as I said, there are different kinds of medicines. They could be intravenous medicines like the drips, they could be tablets, they could be injections in the muscle, injections in the fat, and there are also sometimes we put part of chemotherapy direct into the organ as well. It's available.
So doctor, in terms of the radiotherapy, tukianzia hapa on the radiotherapy and the chemotherapy, and ni which stage ndio zinaanza kutumika, like radiotherapy, because the last time when we talk tulizungumza we have different types of cancer, level 1, something like that, until to level
yes,
4.
the staging.
The
yes,
stage 4.
yes, we
yeah.
were saying about stage 1, stage 2, stage
so
3,
on the
stage 4.
radiotherapy and the chemotherapy, starting from which stage?
So it depends. It's not a straightforward thing like that. It depends on what kind of cancer are we treating. There are some cancers which are more responsive to radiotherapy, and there are some cancers which are more responsive to chemotherapy. And then there are some cancers which need both of them. So it depends on what are we trying to treat, which cancer are we treating, what is the type of the cell, which we look under the microscope and identifies the kind of cancer, and what is our outcome. And then for us also to decide whether the patient is benefiting from chemotherapy or radiotherapy, there's been a lot of research which has been done, which has shown that this particular kind of cancer will respond better to radiotherapy, or this particular kind of cancer will respond better to chemotherapy. Or we can even say that this particular kind of cancer, but say stage 1 or stage 2, there's no need of radiotherapy. Stage 3 needs both chemo and radiotherapy and something like that. So for example, let's take an example of breast cancer. Breast cancer, stage 1 will need surgery might not even need chemotherapy or radiotherapy. Stage 2 will need surgery, will need chemotherapy, might not need radiotherapy. Stage 3 will need all of them: chemotherapy, radiotherapy, and surgery. Yes, so it depends on different kinds of cancers and the different organs as well.
Thank you so much, Doctor. Okay, now let's talk about side effects. Let's start for the radiotherapy first. The side effect for the radiotherapy.
So for radiotherapy, there could be certain side effects. The commonest ones is especially if, for example, the place where we are giving the radiotherapy, it might cause some skin discoloration, darkening of the skin, and sometimes the skin might peel off and give some blisters because of the strong rays. But again, it also depends when they go inside, what organ is it, especially if it is the soft organs, for example, the head and the neck, because our tissues are very soft, it can cause a lot of ulcers and weakening of the tissues when it is going inside. And it also depends on which organs is it passing through. So let's give an example of prostate. When you are giving radiotherapy to the prostate, it passes through the rectum, through the anus, through the bladder, and it can give side effects to those organs. But having said that, the technology is getting better and better with radiotherapy as well. So what happens is that now we can target the radiotherapy to specifically to the organ or to the place where the tumor is, and not to the whole area of the tumor. We can give smaller doses, we have better machines, we can also kind of make the rays in such a manner that before they have reached the tumor, the intensity is not too much, but when they reach the tumor, then the intensity increases for them to be able to kill the tumor. So the machines for radiotherapy have really evolved, unlike the previous radiotherapy machines which were there. And then again, sometimes we might also just give a very short dose of chemotherapy. For example, those people who have their cancers which have spread to the brain or the spine or to the bone. So we just give a small dose of radiotherapy which will kill the cancer around the place where it has spread and stabilize, then make the pain go away. For example, if the bone is too weakened and about to break, then it is strengthened because the cells are dead.
So doctor, there's a difference between the side effect for the radiotherapy and the chemotherapy?
Yes, definitely.
Yes. So what are the side effects for the chemotherapy now? So
chemotherapy, actually there are so many different kind of drugs. There are over 1,000 different kinds of chemotherapy drugs or medicines, and each of them has got its own different side effects. So even before I answer the question of the side effects, probably it would be important for us to say what kind of medicines are there in chemotherapy. So there are the regular chemotherapy medicines which go in drips, the regular traditional medicines, those ones usually have a bit more side effects, and sometimes the side effects are some of them are just temporary. For example, the loss of the hair. Many people are frightened about losing their hair, but that's temporary. Once you finish the course of the chemotherapy, the hair will come back. And it's naturally, yes, it will just come back.
Oh, there's no need to go to Turkey for hair planting?
No, there's no, you don't need to do hair transplant, you don't need to put any medicines. Once the effect of the drug is over, the hair grows back. So that's a very temporary thing. Then sometimes the chemotherapy can make patients feel nausea, vomiting, a lot of acidity, but usually we give medicines to prevent those side effects before we start chemotherapy, and even after that they go home with some medicines to prevent the side effects. One of the major side effects which many people might feel is the blood counts going low or the white cells going low. The job of the white cells in our body is to give us immunity and to protect us from other infections. So when the white cells go low, it means that your immunity is low and you might get other infections. So there are certain medicines or certain drugs which we always know that this one will cause the white cells to drop. So the ones where we know that these ones will cause the white cells to drop, immediately after the chemotherapy, we give them some booster injections to boost the white cells up. Then the white cells don't drop. There are other drugs which the white cells don't always drop in all the patients. Some people, they tolerate them very well and they are okay. So for those, we try to see the first cycle, how it goes. Because some people might flow through the treatment without an effect on their white cells. And if that happens, then there's no need of the boosters. But should we find that their white cells are dropping, then we can give them some booster injections to bring them up. And sometimes we don't even wait for the white cells to drop. If we know that in a certain person the white cells will drop, we give them the booster injections immediately after the chemotherapy. For example, elderly patients. We know the immunity of the elderly patients is not as good as a younger patient like me and you. So those who are over 70 years, we will not risk them to get an infection. So immediately after chemotherapy, we will give them the boosters so that the white cells can climb up. And sometimes the blood levels might also go low. So if that happens, we can give them boosters for the blood levels, or they might even need transfusion. At times, some people might get some mouth sores or so, but if it happens, we'll give them treatment. And then there are other side effects which come in a bit slowly. So they might feel some numbness in the hand and feet. They might get some rashes. They might get discoloration. So sometimes you find that the palms and the soles are becoming dark, or the lips are becoming dark, the nails are becoming dark. But usually that is not a permanent side effect. It's a temporary side effect. Once the medicine is over, the color resumes back to normal. There are others which actually, instead of darkening the skin, they even lighten. Unaweza kufikiria huyo ni mzungu sasa anaingia, lakini after it is finished, the color resumes. So those are just some of the side effects. And what is very important to remember is that not everybody feels the side effects. We counsel everybody that you might, this would be the side effects, lakini si kusema kwa kila mtu atapata hizo side effects. Baadhi ya watu hawapati kitu chochote, they move through the treatment very, very well without feeling anything, but it is important that they know the side effects, so that in case they get any kind of a side effect, they don't get frightened on what is this happening to me.
So doctor, after kutueleza those side effects about the chemotherapy, people may ask, doctor umesema those, most of them are temporary. Do you have a permanent side effect for the chemotherapy?
Yes, sometimes we can have some permanent side effects as well. Usually, at times it happens is that if you've not got the side effect in good time and you've let it go on for too long, and then it can do the damages. For example, like now those drugs or medicines which cause the numbness. So what we need to do is, if we are seeing that the patient has got the numbness, then we need to treat it in good time, or to adjust the dosages as well. And then again, we need to be careful on the liver, kidney, because these are heavy drugs and they might damage the organs. But what we usually do is after the patient has received chemotherapy, 1 week after, we do the blood tests, we see the patient, we make sure that everything is okay, the patient is faring well. And sometimes the patient might not have actually even seen the side effect or felt any side effect. It's us doctors who will see, yes, this side effect is about to occur and we need to take care of this side effect, otherwise it will culminate into something more. So there are certain side effects whereby we can give some medicines to prevent the side effects. Then there are others whereby we may need to adjust the dosage of the drug. Sometimes we may not give them 100% of the dose that they need. We reduce the dose to what the patient might be able to tolerate. Then of course, there are certain side effects whereby we need to, certain drugs whereby we need to be very careful about the side effect. Like there are drugs which need the heart to be good and strong. If there is any problem in the heart, we don't give because they can cause further damages. There are drugs which need the kidney to be good, and we actually adjust the dosage according to what the kidney can handle and according to the weight. Then there are, especially in young patients, we also need to be vigilant about fertility as well. If they are going to, they need to have children or something, because there are some drugs which might alter the fertility, might alter the menstrual cycles, and so we need to be careful about that as well.
Thank you so much, Dr. RIYAZ, for that information about the chemotherapy. Let's go now for the myth. I know without having myth in our society about the chemotherapy, most of them, I think, pengine doctor wasingeogopa. But nowadays, people spreading those myths about the chemotherapies. If ukifanywa chemotherapy, it's all done with your life. So what are those myths, Dr. And how we can fight with those myths?
You are so right. There are so many myths which go on, and every day we get patients, and as soon as we say that you need chemotherapy, and that's a very bad treatment and we cannot tolerate, the side effects are too many. But when chemotherapy is done in the correct manner, in the right place, by people who know how to give chemotherapy and they are experts in it, then they'll control those side effects, and your journey will be smooth. And as I had said earlier, there are so many different kinds of medicines, ranging from intravenous to tablets and to simple injections. So there are all different types, and many of the myths are on the side effects, that the side effects are too many, but those side effects can actually be handled very, very well. And as I said, most of our patients, we see them 1 week after to make sure that if they are having any side effects, we've taken care of them immediately. Should they need blood, should their white cells be dropping and they need boosters, should their blood levels be dropping, should they be facing diarrheas, or should they be facing numbness, we've taken care of it immediately. And then before the following chemotherapy, again, we see the patient, we do the blood test, we make sure that everything is good and their body is good enough to go on with the chemotherapy. And should they need any adjustment, again, we can do the adjustment on their dosages to what they might be able to tolerate.
Asante sana daktari. Nikiamini mtazamaji wangu wa Al-Haajar TV umenufaika pakubwa sana na tatizo ama na topic yetu hii ya siku ya leo, ambapo Dr. RIYAZ anatuzungumza na sisi kuhusiana na masuala ya chemotherapy. Ni aina ya madawa ama mkusanyiko ama mchanganyiko wa madawa ambayo yanachanganywa kwa ajili ya kutibu tatizo hili ya magonjwa hili la saratani. After kuzungumza na sisi about the myth of the chemotherapy, let's talk how we can take care the cancer patient.
So there are different kinds of care that a cancer patient needs, especially those patients who are on chemotherapy. Because of the side effects of the chemotherapy, then they might be feeling that nausea and upsets in the tummy. So usually we recommend that they take smaller meals but more frequently, and then they don't take a lot of spicy food, oily food, because it can give them a lot of acidity, and they are not able to eat all at a go, a good meal at a go. So then we encourage them that after every 2 to 3 hours you take something smaller. We also advise them on the right foods to take, which will help to build their immunity, to build their blood levels. For example, a high protein diet, dark green vegetables, which would help them to make sure that their cell counts are maintaining at that particular level. And then again, those people who might feel the ulcers and the same things, don't take too spicy or tangy foods or so. We encourage bland food for them. And then again, the diet is very, very important for most people, because if they don't eat very well, their strength goes down, and if their strength goes down, then they might not be able to tolerate the medicines well. Sometimes we might give them some food supplements and protein shakes and protein powders and all that to help. And then again, most of the time we advise patients not to go in overcrowded areas, or not to go near people who have other infections and viral infections, who are coughing or who might be able to transmit infections to them, because their immunity is low, so they need to protect themselves. So we advise that you can wear a mask when you are going out or when you are in a crowded place. That just means that you are not going to breathe in bugs from other people. Yeah, and we also advise people that should you get fever at any given time, you must come immediately to the hospital. Whether it's day or night, you must go immediately to the hospital, because if the white cells have dropped, then we can start treatment immediately with the antibiotics and booster injection. And then even if they are having nausea, vomiting, diarrhea, they can become dehydrated very fast. So of course, patients who are on chemotherapy and cancer treatment, they need adequate amount of fluid, but should they be having nausea and diarrhea, then they must come immediately to the hospital, so that if they are getting dehydrated, we can take care of it immediately. We also cover them on medicines to prevent acidity, and also those who get the side effects of the numbness or so, so that we can prevent the side effects from moving on too far. Then we encourage our patients to lead as normal life as possible. In fact, many of our patients, they still continue working as they are doing their chemotherapy, and sometimes I even get patients who say, please let's start early and finish the chemo early, because in the afternoon I'm going back to job. And we are okay with that, because we want people to lead their normal life as far as possible. So many of the people, they continue doing their work like usual and their activities like normal. We encourage people to go ahead and do exercises and to lead their normal life as far as possible.
So doctor, there is a people say that in every patient has a different diet. So what about on the cancer patients? They have a special diet, or is it just a normal diet?
Not that they really have a special diet as such. What we encourage them to do is, one is we encourage them to take fresh food and well-cooked food. That is so that when you cook, the heat kills the germs. And because, as we've said, that many of the patients, their immunity is low and their white cells are low, it means they can't fight infections easily. So when you cook, you are killing all the germs that are there. Hence, the risk of getting an infection is low. And so we discourage them, for example, like now to take salads and so on. Even when they are taking bread, we encourage them to toast the bread so that the heat has killed all the germs. However, there are things like fruits which can't be cooked. So fruits can be taken raw, but you clean them well, you peel them well. Then after cutting, whatever the patient wants, he takes. What cut fruit remains, the rest of the family can use. When he wants fruit again, he can cut fresh again. We discourage patients from taking leftover foods unless they've really heated them well and it's cooked the same day. But food which has stayed over, we discourage them because it might have gotten some germs and can give them infection. But otherwise, there's no special diet. We just encourage them to take good foods. For example, high protein diet like eggs, chicken, fish, legumes like beans, dengu, and all those family of seeds, dark green vegetables like mchicha, spinach, broccoli, because they help to build blood, beetroots, they help to build blood, liver, it helps to build blood. So foods which are good is what we encourage patients to take for the benefit of their body. There are again so many myths that sugar is bad for cancer, milk is bad for cancer. I've stopped all the sugar. Yes, too much sugar is not good for you either ways. Even for diabetics or even for you and me, too much sugar is not good for you, but it doesn't mean that you can't take sugar at all. Sugar in moderation, a little sugar in your tea, coffee, a bit of sweet dish is okay. Those are just myths that it's not, you should not take it at all. Then again, we sometimes discourage patients from taking too much oil and spices, just not because too much the oil and the spices are bad for cancer, but just because of these strong drugs, they might be having a lot of acidity. So if they take spices, chilies and oil, it might bring about the acidity. But either ways, oil should still be in moderation, because even for you and me,
it's not good.
It's not good, and it can bring your cholesterol high.
Yes. So, doctor, I think this one will be my last question for today's section. Some years back, some decades, people living with AIDS tulikuwa tunakuwa isolated na wao. What about the cancer patients?
There's no need to get isolated. Cancer haiwezi kuambukizwa, huwezi kuambukiza mtu na cancer. Kwa hivyo kama mimi nina cancer, I cannot transmit it to you. So it's not a transmissible disease. So it's okay to mingle with cancer patients. There's no restriction for that. In fact, they need a lot of support, and they need a lot of emotional and social support and care. So we actually encourage the caretakers to be close to the cancer patients and support them in whatever way they need. It is not transmissible. Having said that, probably the only thing I can just put a caveat to that is that in a couple, a husband and a wife, one is that sexual intercourse is not prohibited. You can have normal relationship with your husband or wife or whoever is undergoing treatment. The only thing is that we discourage pregnancy, because the development of the baby or the fetus might get affected due to the drugs, and we discourage breastfeeding unless you've discussed with your doctor and he has said that particular drug is safe. But many drugs can pass in the breast milk, so we discourage breastfeeding.
Thank you so much, doctor, for that information. Your advice to the cancer patients and the community at large concerning about the awareness about this chemotherapy, the drugs, and the cancer at all?
We are living in the era of internet. We are living in an era whereby information is rampant all over on the social medias and even on the internet. Go to the right site if you are seeking information from the internet and social media, because not all information is correct and authentic. All those things which are going on social medias, and to say that this treatment will kill you, it will only kill you if it is not being done in the right manner. But if it is being done in the right manner, it will save you. So don't fear, go to the right places, go to the people who are experts in giving this kind of treatment and get your treatment. Because a cancer which is detected early, a cancer which is treated early is highly curable.
Asante sana Dr. RIYAZ Kasmani, ndio tuliokuwa naye katika kipindi cha leo cha Afya na Jamii. Dr. the last one, yes. Watu wanauliza mwenye kufanya chemotherapy anaweza fanyiwa na akapoa akarudi to the normal one?
Kabisa, kabisa. Vile nimesema, yes. We have survivors who have their cancer free right now. Their cancer has gone, and they are free of cancer. They've undergone chemotherapy, some of them have gone radiotherapy, they've gone surgeries, and they are now surviving very, very well. Maybe in future we will also try and talk with some of the patients who have survived cancer, and we see that yes, cancer is curable. The caveat is that we should detect it early. So if you see signs of cancer, one of our future talks will be what is the different kinds of signs of cancer that should alert you that something is not right in your body. But when we see early kinds of cancer, please go to the right place facility and the right doctors who are the oncologists to be screened and to be examined. If there is cancer, then we start treatment as early as possible.
Thank you so much Dr. RIYAZ, na nikushukuru sana wewe mtazamaji wangu kwa fursa yako na wewe kuwa nasi mwanzo hadi mwisho wa kipindi hiki maalum ambapo umepata kujionea facility hii ama kliniki hii ya Mombasa Cancer Center wanachokifanya kuanzia mlangoni hadi katika mchanganyiko wa madawa kwa ajili ya kutibu wagonjwa wa saratani. Vile vile tumekuwa na kikao cha mazungumzo na Dr. RIYAZ akitueleza masuala mazima ya radiotherapy na chemotherapy. Mimi nikushukuru sana kwa kuwa nami mwanzo hadi mwisho. Nilikuwa wako Mohamed Atibu Abdallah, kila ulikuwa na mwanzo ulikuwa sikuwa na mwisho. Fi amanillahi, wewe na wakati mwema. Thank you so much doctor.
Asante sana.
Na good work.
Shukran.
Inshallah.
Assalamu alaykum wa rahmatullahi wa barakatuh. Alhamdulillah wa thana'u lillahi wa salatu wa salamu ala rasulillah wa ala alihi wa ashabihi wa mawala. Ndugu zangu Waislamu, hii ni apili ya ndugu yetu Abdurrazak Omar ambaye anahitaji matibabu ya dharura kwenda New Delhi kutibiwa. Ni mgonjwa na ameweza kupata nusu ya pesa anazozihitaji. Kumebaki 450,000 ili kukamilisha hisabu ya kwenda kwa matibabu. Tunaomba kila mmoja inomfikia hii ajaribu kufikishia marafiki zake, kwa sababu tukipata Waislamu 450 kila mmoja kwa kutoa 1,000 tayari itakuwa ni 450,000. Kwa hivyo pay bill ni 659955. Nitarudia, ni 659955. Account utaweka matibabu. Ani pay bill ni 659955. Kwenye account utaweka matibabu. Kwa hisani yako ikikufikia ujumbe huu, mfikishie mwenzako, kwa sababu kumsaidia mwenzako kutoka katika shida ya ugonjwa ni moja katika jambo la kheri ambayo utapata ajiri mbele ya Mwenyezi Mungu Subhanahu wa Ta'ala. Kwa hivyo fikisha ujumbe huu kwa mwenzako. Wajazakumullahu khair. Wassalamu alaikum wa rahmatullahi wa barakatuh.